Morning, everybody. Dr. Rayford here from Vet Triage. We are going through this issue of JAVMA from May 15, 2015. This is the Pathology in Practice article. There it is. Boom. And let's get right into it. So this case is about 11-year-old foreign warm blood gelding, which is a castrated male horse. It was showing a 2-month history of progressive ataxia, obtundation, and lack of eating. The horse on physical examination showed hypermetria. Hypermetria is a very spastic, exaggerated gait to the leg. And there's also, as they're walking, they are overreaching with that leg. And usually hypermetria we associate with cerebellar disease, but not always. The horse had a tendency to lean to the left. It had a left-sided facial nerve paralysis, and it had a deviation of the muzzle to the right. Those findings typically will indicate leaning to the left might be more vestibular disease, meaning affecting the cochlear vestibular nerve, which makes up both the hearing and the balance. That's in the brain, but also can be in the ear, but most often in these cases, neurologic signs, it's the brain. And then the facial nerve paralysis and deviation of the muzzle, they usually imply cranial nerve abnormalities. That's also in the brain. And then circling to the right, which again could be brain, could be vestibular. By brain, I mean like cerebrum or midbrain, those regions. But the vestibular portion of the brain also could be affected by that, making them circle. So anyway, they tried some medications. The horse didn't do well, and so they euthanized it and did a post-mortem examination. So I'll show you the picture of the brain here. They did fluorescent antibody testing to look for rabies, which came back negative. They cut the brain in half and found a soft, round to oval, pale tan, 6 by 4 centimeter mass present in the right lateral ventricle. The mass appeared cerebriform, meaning brain-shaped or convoluted, and vascular, meaning blood-filled. Multiple variably sized yellow foci, so tiny pinpoint of yellow dots on the mass. And there was dilation of the lateral ventricles, dilation of the mesencephalic aqueduct, and dilation of the fourth ventricle. The periventricular white matter was markedly atrophied. So we'll go over a few things here. So here's a picture of the brain, and that first X I put there, right there, that's the lateral ventricle. Then there's a second asterisk I put in the middle of the brain, right there. That's the mesencephalic aqueduct, and then my last star is right there. That's the fourth ventricle. And those areas of the brain are important because that's where cerebrospinal fluid circulates within the brain, helping with clearing waste, helping with nutrition of the brain cells. And they say here that the perivascular or periventricular white matter was atrophied. So a few things to go over. There's 2 ventricles in the brain. That's the first asterisk that I have here. They're both lateral ventricles. There's a left and a right one. And then as it flows through, as the cerebrospinal fluid, the CSF flows through the ventricles, it'll go through the mesencephalic aqueduct through the midbrain. That's the middle portion right there. And then it'll go into the fourth ventricle here underneath the cerebellum, and then into the central spinal cord canal. Okay, so they found this mass in the lateral ventricle, in the right lateral ventricle. And the periventricular white matter atrophy. Periventricular means around the ventricle. White matter is the portion of the inner portion of the brain that's made mostly of nerve fibers. Gray matter is the outside portion of the brain that is made of cell bodies. And in the spinal cord, they are reversed in terms of location. All right. So then they go into the studying of the mass. They said that the mass was unencapsulated, meaning it did not contain a capsule. Expansile, meaning it seems to be expanding, and densely cellular. So there's cells and they're densely populated. The cells were spindle-shaped cells, spindle cells. They had evidence of malignancy, and Those include finely stippled chromatin. Chromatin is the genetic material in cells, and if they have prominent chromatin or there's changes to chromatin, that implies cellular activity or replication. It displayed anisocytosis, that's anisocytosis, that implies cells of different sizes. That's also a marker of malignancy. They found anisokaryosis, which is anisokaryosis, that implies nuclei of different sizes. So the nucleuses of the cells were different sizes. And they found mitotic figures. Mitotic figures, again, implies replication of the cells. So mitotic figures means that there's mitosis occurring in the cells, which is chromatin replication. And that also is a marker of malignancy. They found foci of necrosis with mineralization, another marker of malignancy as well. All these things point to a cancer of some type. The lateral ventricles were dilated, and there was multifocal subependymal edema and neovascularization. Multifocal means more than one spot. Subependymal means that the ependymal layer, which is the layer lining the ventricles, and that produces the cerebrospinal fluid. Underneath that layer, there's edema, meaning there's fluid buildup underneath the cells that line the ventricles. Neovascularization means that there's new blood vessels forming. So they ended up also testing immunoreactivity. So we mentioned before in other live streams, immunoreactivity is when they take special chemicals or stains and they apply it to the cells of these samples, and they look for to see what cells uptake that chemical or that stain. And specific cells will uptake certain things or show certain characteristics that other cells won't. It helps you differentiate between in situations where the cells either look so dysplastic, so abnormal that you can't really tell what cell origin they are, or it helps identify cells that look kind of similar, but you think they're different. And so immunohistoreactivity is very important for that. So just for the purposes of being thorough, they tested for glial fibrillary acidic protein. They tested for S100 protein. They tested for vimentin. They also tested for cytokeratin and E-cadherin. And again, I'm just listing those just to show you different examples of immunoreactive things that they will test for. So what's cool about this one is usually when I look at these, I don't know what's going on. I mean, I'm not a pathologist, but if you can see closely there, you see how there's there's circles. See how these cells are arranged in circles, and the center of it is a red dot, and these circles are all arranged around a red dot. So that red dot is blood vessels, and the red is red blood cells, and the cells are around it in a circle. And that's really cool. And so that's a distinct factor here. They call those perivascular pseudorosettes. So perivascular means around the blood vessels. Pseudorosettes means they're in a rosette or a rose-like shape. Pseudo meaning they're not 100% rosettes. So that's pretty cool there. All right. So based on this, they diagnosed an ependymoma, man, EPENDYMOMA of the right ventricle, right lateral ventricle with internal hydrocephalus. Hydrocephalus means dilated ventricles, and it can be caused by two different things. One is either excessive cerebrospinal fluid production, or second is an obstruction of the cerebrospinal fluid from flowing out the brain. In either scenario, you end up getting an abundance of CSF, cerebrospinal fluid, and that dilates the ventricles. Okay, ependymoma. So these are rare tumors. They've been diagnosed in dogs, cats, cattle, horses, and people. They are derived from the lining, the epithelium of the cerebral ventricles and central canal of the cord. So these ependymoma cells are the ones that create CSF. They also have other functions as well, but that's mainly what they're known for. And they're located lining the ventricles and within the central canal of the spinal cord. These tumors can be infiltrative to destructive. They can erupt from neuroparenchyma into the ventricular space with subsequent obstructive hydrocephalus and rare dissemination into the CSF. Let's talk about that. Infiltrative to destructive. Infiltrative means that they're going in the tissues, but not really destroying the tissues, whereas destructive means they're infiltrating and causing a deformation of the structures. They can vary in terms of how aggressive they are. Neuroparenchyma implies any of the portions of the brain of the actual meat of it, and then ventricular space is the ventricles. Obstructive hydrocephalus, we already said, is hydrocephalus that's caused by an obstruction of spinal fluid flow. And then they said here rare dissemination into the CSF. Dissemination means that the cells are spreading to other parts of the body, and it's a well-known scenario where cells will flow outside of from the brain into the CSF, into the central canal of the spinal cord, and they'll seed into the spinal cord or other parts of the body. So in people, they characterize these tumors in histologic variants, and I'm just going to list them: cellular, anaplastic, subependymoma, tannicytic, clear cell, papillary, or myxopapillary. And they said here that clear cell and papillary or myxopapillary have been described in horses before. The presence of intratumoral cartilage in humans has been rarely described, and it's not been described in horses. What was interesting in this one, they found, as we said before, they found necrosis with mineralization, and then within that mineralization, they found cartilage-like material, and so that's been not reported before in horses, and it's been rare in people. But what made the distinction that this is an ependymoma in this case, as opposed to any other brain tumor, besides with a perivascular pseudo-rosette or one, but also they did electron microscopy on the samples and found cilia, which are microscopic hairs. And that's typical of the cells that produce CSF. And then also the immunohistochemically being positive for the glial fibrillary acidic protein. And also vimentin was positive as well. So all those combinations help with the diagnosis. Pretty cool. Okay, finally, other differential diagnoses include equine protozoal myelitis, trauma, parasitic infection, viral infection, any diverticulum of the central nervous system or auditory tube, and intracranial cholesterol granulomas, abscesses, or other cancer types. So in addition to ependymomas, other rare intracranial cancers in horses include choroid plexus papillomas and meningiomas. Choroid plexus papillomas are tumors of the choroid plexus. Choroid plexus are cells that were within the ventricular space in the brain. And they also produce CSF as well as other functions. Meningiomas are cancers of the meninges, which are the lining of the brain and spinal cord. The choroid plexus papillomas usually develop at the cerebellopontine angle. And that angle, so cerebellopontine, cerebellum is part of that. Pontine is the area underneath the pons, underneath the cerebellum. And at that angle is where these choroid plexus tumors usually will form. And then meningioma in horses has been rarely reported to involve the ventricular system. Cholesterol granulomas, which is one of the differentials that they mentioned, are the most common masses within the lateral ventricle of older horses. So that was probably what they were thinking initially, until they did the histologic studies on it, like we said, and found all those unique features. And that's it. That's it for today. We'll do it again tomorrow. I hope this helps for those watching on the playback. Thanks for those watching on the playback. Thanks for supporting the channel. We'll see you guys in the next one. Take care.